So, Tracy, what's going on?
Oh, in honor of this wonderful month of May, I told you we had a few topics that we wanted to touch base on. And today, in honor of myself, it is stroke awareness is what we're going to talk to. So I'm going to start y'all off with all the statistical facts. And then on my Instagram page, I'll give you more information. But I want to give you the statistical facts right now. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. 12.2 million people worldwide will have their first stroke this year. 6.5 million will die as a result. So thank God I'm alive. I'm a survivor. Over 110 million people in the world have experienced a stroke in general. But another key factor I thought was wonderful, the fact of 2019 of how many people suffered a stroke. In 2019 was the year that I had my stroke. So definitely I had to highlight that. So giving you the statistical facts of what a stroke is and things you want to look for a person that's experiencing a stroke. One of the main clinical risk factors for a stroke is high blood pressure. So that's why I'm always stressing people, take care of your bodies. Pay attention to your physical level. Be more active. Pay attention to your food intake, your cholesterol intake, all of those things that we don't really pay attention to. So high blood pressure, unfortunately, runs rapid in the Black community, African-American community. So people pay attention to that. Let's do better with our eating. Let's do better with our lifestyle and our health in general. So different things you want to look at. High sodium, high cholesterol, all those things that you're doing. And a lot of people don't pay attention to headaches. A simple headache could mean something. And I'm going to say that to say, which we found out later on before I had my stroke, I was experiencing headaches, which normally I just brushed off because I'm not a person. I don't even have headaches. Like some people say, oh, I have headaches all the time. I'm a person that don't even have headaches. I was having headaches, didn't even pay attention to, and thankfully me being verbal about it. Some of my clients were like, well, I remember you were having headaches 2 weeks prior. I didn't even take anything. I was just like, yeah, maybe it'll go away. But in reality, the headache lingered for about 2 weeks. But it was nothing so bitches for me to be conscious about it. I was just like, okay, it'll wear off. And it kind of still lingered. It was possibly like the doctor said, like a small possible migraine, because I remember squinting and it was just slowly occurring. Ignored it, but it was not something extreme enough for me to go get it checked out. So again,
that's what you thought.
Exactly. So I'm saying people pay attention to those things.
Your body.
Exactly. I should have paid more attention because I'm not a person that has headaches. And I had one lingering for about a week or two. And then which led to me passing out before I got to an event, having a stroke. So in the fact of that.
So just so you say that, the point is, it's nothing wrong with just getting a checkup. If something does seem wrong, it's okay if you take a little time out of your schedule to go just verify. There's nothing, it's not about being overreactive. It's just about being safe.
And that's so true. But thankfully, and there we go. Because if I would have verified,
no, I don't have time. But sometimes
there you go.
Make time.
They could have possibly ran some tests and be like, you know what, your headache is being caused from this 12-inch blood clot that's in your leg.
That you didn't even know about.
I didn't even know about. So all
from
of these
inner injury that you didn't think was that serious.
Exactly. So there we go with, hello people, pay attention to your body, and it's okay to go and get checked up. Listen, call the doctor, get on their nerves. If they say, oh ma'am, there's nothing wrong, guess what? I'm just in here, run all the tests. And that's another thing, start demanding to have these tests run. Because there's another thing, they say, oh, well, you don't need that. You don't follow statistics, you don't follow the age. Guess what? I didn't follow statistics of anything. I never had any health issues, anything.
Yes, you are literally the picture of health.
Exactly. Yeah. And then to have something so sudden happen and boom. But one thing we want to look at, so if this does happen, look at, we use the acronym of FAST when you're relating to stroke. So FAST, the F stands for facial drooping. A stands for arm weakness on one side. Speech difficulties is the S. And time. And time is the essence of all things, because the faster you get a person aid, the faster you can help them, the longer they're away from. And really what happens is when you have a stroke, it's usually a loss of blood supply to the brain. So the longer you lose blood supply to the brain, that's the longer a person has the effects of brain damage to their head.
Gotcha.
So while always saying, okay, we can't quite, as stroke survivors, we can't quite get everything together because our brain is still trying to rewire itself because of the loss of oxygen that we had to the brain. Or you might even have a brain bleed, which is more of a hemorrhagic stroke. Mine on the end was, and I know I'm skipping around, but I'm giving you the different types of stroke. Mine was an ischemic stroke, which that's the loss of blood supply to the blood vessels, which therefore took the oxygen away from the brain. So that's on the ischemic level. And 3.3 million individuals die of an ischemic stroke. So then we also have the hemorrhagic stroke. 2.9 individuals have died from the hemorrhagic stroke. And this is all in 2019. So I did forget, I do apologize. 6.6 million deaths in the year 2019. By the grace of God, the same year I had my stroke. 6.6 million people died from this. I am a survivor.
Yeah.
So all of these things we got to pay attention to just to be more conscious of. And again, month of May is stroke awareness. Be more conscious of your health. Start making different things. Be more active. Change your lifestyle. Just do things and go and get checked up.
Just go get that checkout, like you said. Check your blood pressure.
Yes.
Those are basic tests your doctor can run for you. It's not going to put them out of their way or you out of your way. All right. Well, we are going to get into, of course, our workout, because the thing about it is physical activity can help to prevent a lot of these things as well. But happy Stroke Awareness Month. All right, in honor of our girl Tracy right here. All right, y'all, stay locked right here. It's 93.1 WZAK.